Welcome to Mindful Objective, the podcast where we explore the root causes of your health concerns and uncover real, effective solutions that actually work. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. Today, we're diving into one of the most talked about and misunderstood topics in men's health, and increasingly women's health too: testosterone replacement therapy, or better known as TRT. So, today, let's look at it from an integrative health lens. We offer pre-made hormone lab panels that are anywhere from 20 to 50% off retail and professional grade supplements at a 20% discount to make care more affordable. While others charge inflated prices, our focus is helping people heal. If you need a custom lab panel, we're here to help. Visit discounttrtlabs.com or mindfulobjective.com and feel free to share this with anyone who could benefit. This podcast for educational purposes only. We do not diagnose, treat, or cure any illness or disease. This episode may run a bit longer as testosterone is a common topic, with a lot of questions I see from both clients and online discussions. Towards the end, we'll also take a deeper dive into hematocrit levels. So let's go ahead and get started. Testosterone replacement therapy has exploded in popularity over the last decade. In both men and women, the conversations around hormone optimization are louder than ever. It seems like everywhere you turn, there's a new clinic, new advertisement, or new celebrity sharing how testosterone therapy changed their life. For many people, TRT can be life-changing when used properly, for the right reasons, with the right supervision. But for others, TRT is being offered far too quickly, sometimes after just 1 or 2 blood tests without addressing the bigger question: why is the testosterone low in the first place? And this is where integrative health draws a very firm line that separates the approach from conventional quick-fix protocols. In integrative health, we don't automatically assume low testosterone requires a prescription. Instead, we step back and investigate why hormone imbalances even exist. The body doesn't just randomly stop producing testosterone for no reason. There's always an underlying story. What's our job? Our job's to uncover that. When someone comes to us experiencing symptoms like fatigue, low libido, mood swings, weight gain, brain fog, even low motivation, our first priority isn't immediately to raise their testosterone. It's about asking the right questions and investigating the multiple systems that could be involved. Some of the questions we ask: is the body making enough testosterone by converting it to hormones too quickly? Are nutrient deficiency impairing testosterone production? Is chronic stress driving cortisol up, which suppresses the testosterone pathways? Is the thyroid functioning optimally? Is systematic inflammation interfering with hormone signaling? Could environmental toxins or endocrine disruptors be damaging testosterone receptors? Is gut dysfunction interfering with nutrient absorption and hormone metabolism? So these are all valid contributors to testosterone imbalance. Suppose any one of these underlying issues exists. If that's the case, simply injecting testosterone may mask symptoms temporarily while leaving the root cause unaddressed. So let's look at the problem with conventional TRT model. In traditional clinics, the approach is usually fast. The patient reports fatigue, low sex drive, and mood changes. A testosterone blood test is ordered. If the value falls below arbitrary threshold, this is often around 300 nanograms per deciliter, a prescription of TRT is offered almost immediately. Is this due to making money, or is it due to helping people heal? It's the question. While this may sound efficient on paper, it often ignores the complexity of the human physiology. Hormones don't function in isolation. Testosterone interacts with virtually every other system in the body, from the thyroid to adrenal glands, the liver, digestive systems, vascular system, immune system, and even your brain chemistry. When these broader systems are not evaluated and supported, simply adding testosterone may temporarily improve symptoms, but ultimately create new problems down the road. And we see this a lot in forums. Right? We see a lot of people have complaints and they're doing injections and what it's doing to their body. And a lot of people do injections and do not feel better. These other problems down the road could be estrogen imbalances from aromatization, fluid retention and blood pressure issues, elevated hematocrit and increased blood viscosity, sleep disturbances, mood swings or anxiety, long-term suppression of body's natural testosterone production. That's why a lot of people use HCG along with that, or enclomiphene. We see many men start TRT without fully understanding the potential downstream effects. In some cases, they become dependent on replacement therapy when it's unnecessary. So our approach follows a very different sequence here, doing integrative health: investigate, rebalance, replace, only if necessary. We begin with a comprehensive evaluation that includes much more than just a total testosterone. We assess free testosterone, sex hormone binding globulin, estradiol, which is E2, DHEA, cortisol rhythm, full thyroid function, insulin sensitivity, inflammatory markers, micronutrient levels, gut health, liver enzymes, lipid profiles, and iron status. Once we have this full map of hormone landscape, we begin correcting any identified imbalances through lifestyle modifications, nutritional interventions, targeted supplementation, and stress management protocols. When the root causes are addressed first, many people see their testosterone levels rise naturally, or at least improve enough to restore energy, mood, and libido without external hormone replacement. Because a lot of people don't like pinning every day. A lot of people do not plan to be on something long term, right? But there's different things out there that you may need to address first. TRT does still have its role, but only when the work's done. To be clear, integrative health is not anti-TRT. There's many of us that do use TRT. So, definitely on the integrative health side, we're not against TRT. Certain cases when primary hypogonadism exists, such as irreversible testicular failure, pituitary disorders, and long-standing genetic causes, TRT may absolutely be appropriate. But what integrative health teaches us is this. You earn your prescription after you investigate your body. By doing deeper work first, even if your TRT eventually becomes part of the plan, your body is more resilient. You risk fewer side effects, and your long-term outcome is much better. This is true prevention based on healthcare. It's not about rejecting hormone therapy. It's about ensuring you're not using it as a shortcut while bigger issues go unresolved. Now, for this next section here, let's talk about the whole pyramid of testosterone imbalance. So once we understand that testosterone doesn't simply fall for no reason, the next step is to visualize how various contributing factors stack together. I often describe testosterone imbalances as a pyramid, while multiple levels that must be evaluated from the foundation up. Each level represents a deeper layer of potential dysfunction. When you correct the levels first, many people never reach the point to where hormone replacement becomes necessary. Let's walk through the full pyramid so you can better understand where real problems often hide. Level 1, foundational lifestyle stressors. Right at the very base of the pyramid are daily habits, routines, exposures that quietly erode hormone balance over time. These are usually not dramatic medical conditions. They're slow, cumulative hits that many people dismiss as normal life. Common factors include poor sleep quality and quantity, right? Less than 7 hours per night. Chronic psychological stress, long-term emotional, financial, or occupational stress elevates cortisol, and this will suppress your testosterone. Poor nutrition characterized by highly processed foods, low protein intake, insufficient healthy fats, and micronutrient-poor diets. This starves the hormone-building pathways. Physical inactivity or overtraining, right? Both are extreme. Too sedentary or too chronically overtrained. These can suppress testosterone output. Alcohol consumption, excessive alcohol intakes interfere with liver function, hormone conversion, and nutrient absorption. Then you have your environmental toxins, BPAs, pesticides, heavy metals, industrial chemicals. These all disrupt hormone signaling at the receptor level. If these foundational factors aren't addressed, everything else higher up on the pyramid will struggle to stabilize, no matter how much testosterone you try to add later. The level 2 of that pyramid will be micronutrient deficiencies. Even when lifestyle habits are reasonably in place, nutritional status plays a huge role in testosterone production. These key nutrients include zinc, magnesium, vitamin D, B vitamins, this is especially B6, B12, folate, healthy fats, and cholesterol. Key nutrients include zinc, this is critical for testosterone synthesis and aromatase regulation. Magnesium supports enzymic pathways required for testosterone production. Vitamin D functions as a prohormone, directly influencing testosterone levels. B vitamins, especially B6, B12, folate, these are involved with methylation, neurotransmitter function, and energy metabolism. Healthy fats and cholesterol serve as the raw building blocks for all the steroid hormones. Selenium, iodine, omega-3s, this influences thyroid function, inflammation, and cell membrane signaling, which indirectly affects testosterone. So many people unknowingly run borderline deficient in these nutrients for years, especially when gut absorption is impaired, dietary variety is usually poor, and your stress usually will remain high. So even small micronutrient gaps can significantly impair testosterone output long before medical deficiencies show up. So as you move up the pyramid, metabolic dysfunction, which would be level 3, This often begins to take center stage. Blood sugar instability, insulin resistance, metabolic syndrome, non-alcoholic fatty liver, subclinical hypothyroidism, high homocysteine and systematic inflammation. Each of these conditions directly interfere with hormone signaling, hormone receptor sensitivity, and the body's ability to convert precursor hormones into usable testosterone. High insulin levels in particular suppress sex hormone binding globulin, alter free testosterone levels, and overstimulate pathways that can disrupt proper hormone balance. Metabolic inflammation further amplifies this dysfunction, making testosterone production more erratic and insufficient. Level 4 would be your endocrine disrupting chemicals. These are everywhere, right? Plastics, pesticides, herbicides, heavy metals, mercury, lead, cadmium, aluminum, household cleaning chemicals, personal care products loaded with parabens, fragrances, and artificial preservatives. These compounds often mimic estrogen-like effects in the body. These will interfere with your testosterone receptors and impair the body's hormone feedback loops. While these exposures may seem small in isolation, cumulative effect, often referred to as toxin burden, adds another layer of dysfunction to the top of the lifestyle and nutritional and metabolic issues. We see this all the time, and reason we run so many heavy metal tests. And a lot of people are coming back with high aluminum, high mercury. It's just a common thing, and a lot of people are coming back very deficient in certain micronutrients that your body needs. So level 5 and the final level of this pyramid is true primary hypogonadism. At the very top of the pyramid sits true primary hypogonadism. This is irreversible causes where the testes, pituitary, and hypothalamus fail to produce sufficient testosterone despite all others functioning well. And if you go to a normal clinic, this is what they might diagnose you as just because your hormone levels are low, without looking at the pituitary gland and so forth. It may also include genetic conditions, severe trauma or injury, chemotherapy, radiation damage, pituitary tumors or dysfunction. In rare cases, TRT is often fully appropriate and necessary because natural production simply cannot be restored. By following this layered approach, we can identify correctable causes before rushing into lifelong hormone replacement, build a healthier system that naturally improves hormone balance, make any eventual TRT far safer, far more effective, and more sustainable when genuinely needed. This pyramid reminds us that hormones never exist in isolation. They're the outcome of multiple systems working together or failing together. And unless you're addressing all layers of dysfunction, no amount of testosterone replacement will deliver lasting results you're looking for. You see it in the forums, right? We see a lot of complaints. Yes, you do not see always success stories in a lot of these forums, but you see a lot of people, 50,000 people in a group, and you wonder why so many people are complaining. Is the foundation being addressed? The answer is usually no. It's no fault of anybody's, but it's usually an education kind of thing. So that's what we're here trying to do today. So the next part we need to talk about is supplements that naturally support testosterone. In that integrative health model, we never start by assuming that hormone replacement is the only option. The body has a remarkable capacity to self-regulate, but only when it's properly supported. Often, testosterone levels decline because the body's lacking essential raw materials, cofactors, or functional nutrients required to sustain optimal hormone production. Before considering any form of external testosterone therapy, one of the smartest and safest first steps is correcting nutritional deficiencies and supporting the body's hormonal machinery directly. Here's a detailed breakdown on the most evidence-backed supplements that may naturally support testosterone production. The very famous one is vitamin D3. This is a hormonal master switch. Vitamin D functions more than a prohormone. Vitamin D functions more like a prohormone than a simple vitamin. It influences over 1,000 genes and plays a direct role in testosterone synthesis by supporting the function of the cells within the testes. Studies consistently demonstrate low vitamin D correlates with low testosterone. Vitamin D deficiencies improve testosterone production and bioavailability. Deficiency is very common, particularly in those with limited sun exposure and poor gut absorption. We typically aim for serum vitamin D 25-hydroxy levels between 50 and 70. This is what we consider optimal balance. Typical dosing is 4,000 to 6,000 IUs daily as the starting dose. Higher doses may be appropriate for individuals with absorption issues, but they should always be monitored. We always pair vitamin D3 of vitamin K2 in the MK7 form, and usually this is 100 to 200 micrograms daily. This ensures proper calcium metabolism and vascular safety. And I have a direct podcast on vitamin D that was recently released. So if you're interested in that, feel free to check it out. Another one would be DHEA, right? This is the adrenal hormone precursor. DHEA sits upstream of testosterone and estrogen production. Chronic stress, adrenal dysfunction, and aging all contribute to lower DHEA levels, which may indirectly suppress testosterone output. Low DHEA is often seen in individuals with fatigue, burnout, sleep disturbances, poor recovery. The typical common dosing is usually 10 to 25. Always test DHEA levels before starting, as excessive dosing can cause unwanted side effects, including unwanted estrogen elevations. DHEA should also be used under supervision of a practitioner in conjunction with a comprehensive adrenal support protocol. One thing out there to note too is usually people get their vitamin D levels optimal range, then get their DHEA in optimal range, and sometimes you may see testosterone raise. Another one would be zinc. This is a testosterone mineral. Zinc plays multiple roles in testosterone regulation. This supports your HPG axis and inhibits aromatase activity, reducing unnecessary testosterone conversion into estrogen. It supports your sperm production and reproductive functions. Common signs of deficiency would be poor wound healing, frequent infections, altered taste or smell. Do you eat something and don't taste sweet? Or certain foods do not have a taste? Oftentimes that's tied back to zinc deficiency. Low libido, hair loss. Typical dosing is 30 to 50 milligrams of zinc picolinate daily. Prolonged high dosing requires balancing with copper, typically 2 milligrams of copper for every 30 to 50 milligrams of zinc. Zinc deficiency is another one that's surprisingly common, especially in vegetarians, those with gut issues, or individuals under chronic stress. Now the next one we hear a lot about too is magnesium. This is the multisystem cofactor. Magnesium deficiency affects over 50% of adults and contributes to poor testosterone synthesis, insulin resistance, poor sleep, high inflammation, increased cortisol levels. Clinical studies have shown that magnesium supplementation may improve both free testosterone and total testosterone levels while also enhancing sleep quality and metabolic function. So the preferred forms we suggest is usually magnesium glycinate. This is excellent for calming, sleep, and nervous system regulation. Magnesium malate supports muscle function and energy production. Typical dosing for this is 400 to 600 milligrams daily. The next one would be adaptogenic herbs. Because chronic stress often suppresses testosterone via elevated cortisol, adaptogens may play a role in natural supporting balance. Top adaptogens would be very common. One, ashwagandha. This supports testosterone levels, lower cortisol levels, improves sleep, and enhances fertility. The dose is usually 300 to 600 milligrams daily. Tangat Ali. This may increase free testosterone by lowering SHBG and improving libido. The dose for this is typically 200 to 400 milligrams daily. Shilajit, rich in fulvuric acid. This may support mitochondrial and testosterone function. Typical dose is 250 to 500 milligrams daily. And the final one would be maca root. This more directly supports libido and energy through the testosterone itself. Dose usually is 1.5 to 3 grams daily. Another one would be omega-3 fatty acids. This is great for inflammation. Inflammation impairs testosterone production and receptor sensitivity. So omega-3s may support hormone health by lowering systematic inflammation, supporting vascular function, improving insulin sensitivities. So typical dosing we recommend is 2,000 to 4,000 milligrams combined EPA DHA daily. Third-party tested because a lot of omega-3 supplements out there contain a lot of mercury, or other metals for that fact. Another one would be boron. This is a small but powerful mineral. Though less discussed, boron may play a meaningful role in lowering SHBG, supporting vitamin D metabolism, modulating inflammatory markers. Typical dosing for boron is usually 3 to 10 milligrams daily. So short-term use is often sufficient, and it should be always paired with the full nutritional foundation. So again, these supplements do not act like synthetic testosterone injections, not at all. Instead, they restore raw materials and signaling pathways that the body needs to function properly. For many people with borderline testosterone levels, or even those with symptoms that may reflect functional imbalances, optimizing these nutritional foundations often produce meaningful improvements in your energy, in your mood, your libido, sleep, metabolism, even your recovery. Even for individuals who eventually pursue TRT, establishing these foundationals first makes therapy more effective, safer, and long-lasting. And you'll see this on the blood work. So the next one, let's talk about supplements we recommend even for those that are on TRT. One of the most common misconceptions about TRT is that once someone starts therapy, nutritional support and lifestyle strategies become less important. After all, you're receiving testosterone directly, right? So why does your body still need additional support? The truth is, starting TRT doesn't eliminate the need for integrative care. It increases it. When testosterone levels are elevated pharmacologically, you're shifting multiple systems at once. While the benefits of improved energy, mood, libido, and strength can be profound, TRT creates ultimately new dynamics that need proper management if long-term safety and optimal outcomes are your goal. Let's explore why supportive care remains critical even after TRT has begun, and what we recommend in our clinical practice. When you introduce exogenous testosterone, several physiological shifts occur. Increased red blood cell production, hematocrit, greater aromatase activity converting testosterone to estrogen, shifts in insulin sensitivity and blood support regulation, potential for prostate stimulation in some individuals, right, as your prostate levels rising, greater metabolic demand on the liver for hormone metabolism, sleep changes, both positive and negative, depending on the individual. So each of these pathways require nutritional cofactors, antioxidant production, and metabolic balance to function optimally. In neglecting this support, you may start to experience side effects such as mood swings, estrogen imbalances, blood pressure issues, elevated hematocrit, sleep disturbances, even cardiovascular strain. But with proper integrative care, however, most of these potential side effects can proactively be managed, often without additional pharmaceutical interventions. So let's touch on one of the most notable effects on TRT is a hematocrit. The concentration of red blood cells in the blood. While mild increases are expected and even beneficial in oxygen delivery, excessive hematocrit can increase viscosity and strain on the cardiovascular system. I would touch on this slightly here, but towards the end of this episode, we'll get more in depth about hematocrit. I know this is a hot topic. So key nutrients include omega-3 fatty acids, vitamin K, again, MK7 form, natal kinase, hydration, electrolyte balance. This is very important. This ensures optimal plasma volume, reduces artificial elevations in hematocrit concentration. So for individuals with rising hematocrit, these nutritional support often help stabilize them without an immediate need for a phlebotomy. However, medical monitoring remains essential. This is a critical factor in your blood work that should be a priority of yours. Another one, as we touched on slightly, is prostate health. While current research does not show that TRT directly causes prostate cancer, testosterone can stimulate prostate tissue growth in some men, contributing to urinary symptoms or BPH. Hyperplasia. We often recommend saw palmetto extract, usually like 320 milligrams daily. This supports your healthy DHT activity. Beta-cesterol, 60 to 130 milligrams daily. This may assist urinary flow and prostate comfort. Zinc, that's another one, 30 to 50 milligrams daily. This will support proper enzymic activity involved in the prostate health. So the simple stack often enables to maintain healthy urinary functions while benefiting from testosterone replacement therapy. Another one would be estrogen balance and aromatization support. So testosterone naturally converts into estrogen through enzyme aromatase. Right? Some estrogen is both normal and necessary for maintaining bone density, promoting mood stability, and enhancing libido. However, excessive conversion can lead to breast tenderness, water retention, mood swings, fat gains, breast tissue growth, gynecomastia. Rather than immediately turning to pharmaceutical aromatase inhibitors, which often create their own problems, a lot of people have problems on this. There's natural ways you could do this. DIM. This is a very popular supplement, 100 to 200 milligrams daily. Milk thistle and NAC. This supports liver function to promote safe estrogen metabolism. This strategy will enable the body to regulate estrogen levels more gently and reduce likelihood of oversuppressing estrogen, which creates additional risks. Another one would be blood sugar and metabolic stability. TRT does interact with insulin sensitivity in complex ways. It may improve insulin sensitivity in some, others may experience worsening blood sugar control and underlying metabolic issues that are present. To support this, we usually use berberine 500 milligrams twice daily. This will support your insulin sensitivity and glucose control. Another one would be magnesium, usually at 400, 600 milligrams daily. This is essential for glucose transport. Chromium and ALA, alpha lipoic acid. These are additional insulin sensitizers, often used in combination of a protocol. And another one that's always harped on is sleeping well. Testosterone metabolism and sleep are tightly linked. Poor sleep interferes with hormone signaling. We frequently recommend magnesium glycinate 400 milligrams to promote deeper sleep, restorative sleep. L-theanine 200 milligrams. This calms racing thoughts at bedtime. Stay off your phone too. That's another one that keeps you up at bedtime. Glycine, usually around 3 grams. Low dose melatonin. This may help reset circadian rhythm as needed. That's usually 0.3 to 1 milligrams daily. The point here is TRT doesn't replace foundational health, right? Even when TRTs are properly prescribed, it's never a substitute for building and maintaining metabolic resilience. The goal is to create an internal environment where TRT works with the body, not against it. Fewer side effects, more stable lab markers, longer-term success on therapy. And that's where integrative health excels, right? Ensuring every system supported with testosterone metabolism. You want to be properly nourished, monitored, and balanced for the long haul. What's your long-term goal? That's what we want to go for. Now let's look at nutritional deficiencies behind low testosterone. When someone presents the symptoms that suggest low testosterone, it's easy to immediately focus on the hormone itself, right? A lot of clinics do. Measure it, diagnose it, and replacing it. But one of the most overlooked and correctable contributors are hormone imbalances, including testosterone decline. It's something far more simpler. Nutritional deficiencies, one of our primary focuses here. In many cases, hormones aren't the root problem. They're simply the downstream signal that something upstream is lacking. Before anybody listens to this podcast that's on TRT, when did you go to a clinic and they say, you know what, first thing we got to do is focus on your nutritional aspects. What are you doing daily basis? What do you eat? What supplements do you take? Let's look at your levels. Let's see if you're deficient in any areas. The answer is usually no. And that's what we do from an integrative health perspective. Let's explore how nutrient imbalances can suppress testosterone, how we identify them, and why correcting deficiencies often allows testosterone levels to rebound naturally, even before hormone therapy is even considered, which a lot of people do not know. Again, no fault of anybody's. It's all about education. That's what we're here to do, help people heal. Every hormone your body creates, including testosterone, requires a complex chain of biochemical reactions. These reactions rely on vitamins, minerals, amino acids, fatty acids, cholesterol, antioxidants, functional enzymes. But if any of these building blocks are missing or marginally deficient, your body's ability to synthesize hormones can stall or weaken. We see that a lot with people on TRT. And you don't need to be clinically deficient for these disruptors to occur. Even mild insufficiencies can meaningfully impact hormone function. This is why many individuals experience symptoms of low testosterone long before their levels drop into officially low diagnostic ranges. And they feel it a lot of times just with the symptoms themselves. Let's break down the most influential nutrients and how they directly impact testosterone. Zinc, right? Cofactor, we talked about that one. That has a lot to do with synthesis and aromatase regulation, lower testosterone, elevate estrogen, poor sperm health. Magnesium, vitamin D, those Bs, omega-3s, protein, right? Amino acids. This is a main building block for hormone creation. Another one would be healthy fats, cholesterol, saturated fat. This is the backbone for steroid hormone synthesis. And yet a lot of people are being told to stay away from cholesterol and keep their cholesterol low. Selenium, antioxidant protection. Iodine, that's a good one. It supports your thyroid function, slow metabolism, and direct testosterone suppression. Let's look at common real-world deficiency scenarios that we saw here at Mindful Objective. We oftentimes see several patterns where nutritional imbalances directly impair testosterone levels. Case one would be a low-fat diet. Some individuals adopt extremely low-fat or plant-based diets that fail to provide adequate cholesterol, saturated fats, and fat-soluble vitamins. All these are essential for raw materials for steroid hormone production. Consuming under 30 grams of fat per day, simply increasing intake of grass-fed beef, pasture-raised eggs, wild salmon, avocados, olive oil, alongside targeted micronutrient support resulted in an increase in testosterone without any medication. Again, just by addressing those certain deficiencies, an increase in that fat and cholesterol and an increase in the vitamins, it helped raise somebody up 150 nanograms per deciliter. That's a huge improvement. Case two would be digestive dysfunction. Nutrient absorption is just as important as nutritional intake. So this is for individuals with leaky gut, dysbiosis, gluten sensitivities, long-term antacid use, chronic diarrhea or IBS. They often struggle to absorb key nutrients like zinc, magnesium, vitamin D, B12. Addressing gut health allows proper nutrient repletion and indirectly restores hormone output. Case 3, chronic cortisol elevation consumes nutrients. This is from chronic stress and adrenal burnout. But another one would be case 3, chronic stress and adrenal burnout. So chronic cortisol elevation consumes nutrients like magnesium, vitamin C, B vitamins, zinc. Utilizing an organic acid test, we come across a lot of clients that do have a lot of vitamin deficiencies. We may see issues with low vitamin C, low B vitamins, and so forth. When stress remains high, these nutrient drains impair testosterone production at multiple levels. You want to support your adrenal health, manage stress loads, and replenish depleted nutrients often. This will allow testosterone levels to rebound naturally. And this is what you do not hear from a lot of clinics. They just say, nope, you're diagnosed with this, you have this condition, it's just your body doing that. And they do not always know that, right? Some do. Some are really great in hormones. Other ones are just there to sell a product. So still, even if you decide to go TRT route, at least address those nutrient deficiencies. So people often ask, how do I identify nutritional deficiencies? A lot of clinics do not do that. So rather than guessing, we test. Functional lab panels help us identify subtle imbalances before full-blown deficiencies manifest. Common assessments includes micronutrient panels, organic acid test. Very common one here we always do is organic acid test, a comprehensive stool test, inflammatory markers such as CRP, homocysteine, ferritin. We also run full thyroid panels, TSH, free T3, free T4, reverse T3. These tools allow us to build highly customizable nutrition protocols based on actual functional needs, not assumptions. In many individuals with borderline or moderately low testosterone levels, correcting these issues of nutrient deficiencies result in restored energy and mood. We've seen improved libido and motivation, better muscle strength and recovery, stabilized blood markers. So even those who eventually pursue TRT, optimizing nutrient status beforehand helps reduce required TRT dosing. You might not need as much. It helps you minimize side effects, improve treatment response, long-term cardiovascular risks. You want to be optimal. You don't want to just feel good. You want to feel optimal. And you want to have long-term health, which you got to focus on. Not short-term, long-term. What we always suggest is before anyone considers hormone replacement, it's critical to step back and ask, is your body being fully supplied the raw materials it needs to produce hormones naturally? Because at the end of the day, hormones sit at the very top of the long chain of metabolic processes. If you build that chain properly with balanced nutrition, digestive function, and cellular support, your body often does much of the work itself. This is one of the greatest advantages of integrative health model. We aren't trying to manipulate hormones. We're restoring the environment that allows hormones to function properly. Now let's move on to the final segment here, which this is a big one for a lot of people that like to talk about, is hematocrit on TRT. Why does it raise? Who's at risk? And how to support it naturally? One of the most frequently discussed concerns with testosterone replacement therapy is hematocrit, the percentage of your blood composed of red blood cells. As TRT becomes more common, so do questions about why hematocrit rises in some people, how concerned we should be, and what could be done about it in a supportive, integrative perspective. Let's break this down clearly so you fully understand what's happening and how we approach it clinically. Because I see a lot of people in forums, they understand their hematocrit's raising, but they don't understand why and what they need to do about it. And there's a lot of misinformation out there. Hematocrit simply measures how much of the blood volume consists of red blood cells. For example, hematocrit of 45% means that 45% of your blood is red cells, and the remaining 55% is plasma, white blood cells, and platelets. This is very important to check. Red blood cells are critical because they carry oxygen throughout the body. But if hematocrit rises too high, your blood becomes thicker. And this can increase strain on your heart and blood vessels, potentially elevating cardiovascular risk if left unchecked. Mild increases are often well tolerated, but once hematocrit rises above certain thresholds, this is usually around 52 to 54% in men, careful monitoring and supportive intervention may be appropriate. Why does it raise in the first place? It's because testosterone stimulates the production of erythropoietin. This is a hormone made by the kidneys that signals the bone marrow to produce more red blood cells. This is one of the reasons many people feel more energized and mentally sharp after starting TRT. More oxygen is being delivered throughout the body at that point. However, not everyone responds the same way. For some, TRT raises hematocrit only slightly. For others, hematocrit rises aggressively even at the same dosage. That leads us to the key integrative question. Why does hematocrit rise excessively in certain individuals but not others? The answer is largely in a metabolic environment that exists before TRT ever began. Certain hidden factors will amplify hematocrit elevation. One of these would be insulin resistance. Elevated insulin stimulates additional production, further increasing red blood cell count. This is why individuals with metabolic syndrome and prediabetes are often more prone to elevated hematocrit on TRT. Another one that's very popular is sleep apnea. Undiagnosed sleep apnea leads to chronic low oxygen at night. The body compensates by producing more red blood cells to carry additional oxygen. TRT simply amplifies this mechanism. Another one would be nutritional deficiencies. So key nutrient imbalances impair vascular health and oxygen delivery, and this will increase red cell production. Magnesium supports blood vessel relaxation. Omega-3 promotes red blood cell flexibility. Nitric oxide precursors improve vascular tone. Zinc and taurine support antioxidant production in red cells. Another one is iron dysregulation. Some individuals have genetic tendencies towards iron overload, which fuels additional red blood cell production. And another one, this is one of the most common, is dehydration. Even mild dehydration reduces plasma volume, artificially raising hematocrit concentration without actually increasing red cell mass. Drink more water with electrolytes. That's key, right? Drink a lot of water. Another one would be nitric oxide deficiency. Poor nitric oxide production, common with aging, low activity, or poor diet. This reduces your vascular flexibility, making hematocrit changes more problematic. And the final one would be chronic inflammation. This is another reason we do certain functional lab tests to look at your inflammation. So low-grade systematic inflammation alters bone marrow signaling, increasing red cell production while impairing the body's natural checks and balances. How do we support this hematocrit stability while people are on TRT? Rather than simply reducing testosterone dosages or frequent blood donations, we focus on correcting upstream metabolic factors. Key supportive strategies is improved insulin sensitivity, right? This could be berberine, and you want to correct magnesium, zinc, omega-3 deficiencies. You also want to support your body's nitric oxide production, so beets, leafy greens. Evaluate and treat sleep apnea if you do have it. Monitor and manage iron stores. How are your iron levels? Optimize hydration with electrolytes. This will maintain plasma and volume stability. Reduce that inflammation. Curcumin, omega-3s, your gut health. You want to normalize your bone marrow signaling. Although no supplement directly lowers hematocrit like blood donation would, and a lot of times people do a blood donation and it's really quick and it'll lower those levels, other people just drink tons of water and see a big difference. But certain nutrients may help support healthy blood viscosity and vascular function. Another one that we didn't talk about is natal kinase. This will help assist with healthy blood flow. Berberine improves insulin sensitivities. Curcumin can reduce systematic inflammation. Taurine, this will support your nitric oxide production and vascular tone. CoQ10, this supports your mitochondrial and cardiac efficiencies. L-citrulline, this supports nitric oxide production and vascular dilation. While these compounds are not designed to treat or prevent hematocrit elevation, they may help support metabolic stability in individuals managing TRT or related blood changes. So the big picture, it's just not about your testosterone dose. Testosterone replacement amplifies what's already present in the system. When metabolic dysfunction, inflammation, nutrient deficiencies, or oxygenation issues exist, TRT may unmask those imbalances, leading to hematocrit increases. So it's not just specific to TRT. It's different issues with the body. So you want to address these contributors. Many TRT patients stabilize hematocrit naturally while maintaining full therapeutic benefits. You think this is enhancing your TRT. So you may be able to lower that dose. You may feel better. Ultimately, TRT doesn't work in isolation. The better we support the terrain, the more stable and safer testosterone replacement becomes. Again, we want to get you to that optimal level, right? We want you to, if you're on TRT, one, is TRT even needed? Or is it that the dose you're on is needed? Or is it you just have deficiencies and it'll help stabilize those TRT and those side effects you're experiencing? There's a lot that goes into this that a lot of people do not look at. We're looking at this from an integrative health lens. We want to focus on helping people heal and optimize their testosterone naturally, their hormones. And one way to do that is foundational aspects. Let's make your body better. Now, let's wrap things up. Again, we're not against TRT. We simply believe in earning the prescription by doing investigative work first. So, whether you're considering TRT, already on therapy, or simply want to optimize naturally, there are ways and steps you could take to build a stronger foundation. As always, if you're looking for lab testing, foundational supplements, or personalized plan, if you're looking for lab testing, foundational supplements, or personalized plan, visit us at Mindful Objective, mindfulobjective.com, where we make root cause healing practical. As a reminder, this information provided in this podcast for educational purposes only. It's not intended to replace medical care, diagnose any condition, or serve as individualized health advice. As always, consult your licensed health practitioner before making any health decisions. So until next time, stay curious, stay proactive, and stay well.